Cancer Safe is so important for our area because far too many people in South Yorkshire are diagnosed with cancer as part of an emergency admission. They're diagnosed with late stage cancer when treatment is less effective and when survival is decreased. And so it's really key that we try to address that and we are proactive in addressing that.
The Be Cancer Safe project is so important because it is about reaching people in the community where they are. I think not being clinical, not being medical really helps people to engage. They don't feel they're being judged. It's okay to say, I don't do something or I worry about something. And as soon as you say you're not medical, it seems to open up people to talk and share personal experiences or personal reasons without that fear that they're going to be judged or told off.
I think the visual aids really help, the prosthesis, the jar of tar and things like that. With the deaf group, sometimes they would give us a signer, and I do have my visual aids and somebody is signing for me, so you can speak to them. And with the partially blind, of course, I speak and they can feel, so I do pass around the lumps and the breasts and they have a look at it. So it's going slowly, slower than usual. It's reiterating the things we're saying, reiterating the screening programs, reiterating the early signs and messages.
Well, I think being aware of the signs and symptoms of cancer is very important because the actual screening programs they've got, they're not compulsory, so not everybody wants to go. So when we talk to people about going for the cervical smear test or the mammograms, there is some people in the community that don't want to go, whether it's for they're embarrassed, they've heard it's painful, it's not for them, or they can't get there because of the GP's times, etc. Everybody's got their own reasons, and every one of these reasons is valid. So at the very worst, if people won't go for the screening, at least if we're out there and make them aware of the signs and symptoms and what to look for, if anything changes for them, then they're better informed and they can actually go and see the GP.
I think it's a subject that makes people nervous, that makes people afraid, that scares people, makes people anxious, not want to talk about it. Like, I've been working with people with learning disabilities, so actually broaching the subject in the first place is quite difficult. But once we're getting it out there and it becomes like normal to talk about, and you can make it in a fun way, you can kind of have a laugh with it to get the message across and to learn signs and symptoms and things like that. So, you know, it's just to familiarise people with it.
I think nowadays people are talking a lot more about cancer. For example, years ago people did not want to mention the word cancer at all. But nowadays I have seen a definite increase in people's willingness to talk about cancer because, I've seen the difference. They approach me now, when in the past I had to approach them. So that, to me, that's a big difference. But with social media, with lots of messages on TV, and people wanting more information nowadays, I do think gradually we are changing these myths and misconceptions, like we call them busting myths about cancer.
I think it's so important just because it saves lives and getting that message out there, spreading it as far as wide as possible, making cancer not a subject to be nervous of and be afraid of, but to be able to talk about it and spread the message out there.